Hello, and welcome to Distillations. I'm Alexis Pedrick. In response to the coronavirus pandemic, we've launched a brand new series focused entirely on COVID 19. Over the next several weeks, we'll be bringing you interviews with people working at the heart of the crisis, including biomedical researchers, physicians, and public health experts. For this episode, we talked to Sue Desmond-Hellmann, an oncologist who worked with cancer patients in San Francisco during the HIV epidemic in the 1980s. She was the president of product development at Genentech, one of the largest biotech companies in the world, and up until December of 2019, she was the CEO of the Bill and Melinda Gates Foundation. Much of their work is focused on infectious diseases, so the COVID 19 pandemic is right in their wheelhouse. We spoke with Sue to get her perspective on the crisis. So, first of all, thank you so much for doing this. Your work has put you in the center of this. I mean, between cancer research, HIV research, not to mention all the work with the Gates Foundation and sort of thinking globally. But how has that informed your perspective of this epidemic?
Oh, in every way. To start with, and I think this is true for so many people, those of us who were in training, and literally, I finished medical school in 1982.
Right.
HIV was first described, it wasn't called HIV then, in 1981. And so being on the front lines, and I don't think it was as intense. I'm sure it wasn't as intense as it is today. But my husband, who's an infectious disease doc, and we were in a study where our blood was drawn to see if we had acquired AIDS
Wow.
as caregivers. And so that intensity of experience where there's so much uncertainty, you don't know what's going to happen. The patients are so very, very sick and dying in large numbers, brings me back to those days where it just was really, really frightening. It was
Yeah.
frightening and uncertain. But then if you fast forward to seeing what happened during Ebola, seeing what happened during Zika, um, the and looking at SARS and MERS, and working with Bill Gates, who has been pushing all of us to be ready for something much scarier than Ebola.
Right.
And the novel coronavirus fits the bill. It's spread through respiratory. Its most difficult thing in many ways is the ability to spread it when you are asymptomatic or pre-symptomatic. And so that brings forward something that I think few of us really thought about, because Ebola, when you're sick, you're sick.
Yes,
You're
there's no
visibly sick.
doubt.
Yeah. There's very little doubt when you have Ebola. When you have early novel coronavirus, you can look just like your average person. And so these pictures in the airports or other places of people having their temperature screened, it's estimated only about half of people, and maybe less, who have the novel coronavirus have a fever.
Mm.
This is rough, but I definitely feel like it's brought together a lot of aspects of pandemic preparedness, infectious disease, vaccinology, product development, a lot of things that I've been around and talking about and working on for a long time.
No, that makes complete sense. I mean, it sort of leads into my next question, which is really, what has impressed you about science's response to this pandemic, and or frankly, what has worried you as we are also all in this period of worry and anxiety and fear.
Well, I'll start with the good news. The good news is that, and take vaccines as an example. Vaccines and therapeutics, the life sciences community, from the very start of having the sequence for the virus, has collaborated, has
Hmm.
pushed themselves to, as safely as possible, go as fast as possible, have looked at every way possible to push how quickly we can get a vaccine or a therapeutic, starting with repurposed drugs like remdesivir.
Right.
So I think on the vaccine and therapeutic side, I could not have asked for more from the entire life sciences community, including FDA, NIH. Everybody involved, I think, has just exceeded what you would call expectations. Now, that doesn't mean remdesivir is not a cure, and we don't have something that blows you away on the therapeutic side, but there's many more medicines in testing, and in the vaccines I think people are doing a very good job so far of looking hard at how quickly we can go while still being safe. There's two areas on the science front that I'm most disappointed in. One is on the diagnostics front.
Hmm.
It's just, and we've serially underinvested in diagnostics, but I also think we just lack the right words. I mean, I know if somebody says that this is for a therapeutic not yet proven, we have a vocabulary and a way of operating and a lot of well-funded companies. In
Right.
diagnostics, we tend to have underfunded academic labs. We don't readily differentiate between what's a research diagnostic and a definitive, believable diagnostic. We lack reagents. And so I think in the diagnostic space, I hope there'll be a call for an upgrading of investment, of nomenclature, vocabulary, of toolkit. So on diagnostics, we need to do better. And the other one, to my surprise, because I've spent a lot of time around it at Gates Foundation, is the whole aspect of modeling.
I've heard a lot about this.
Yeah, your husband's a math teacher, so
Yes.
you know that. But being mathy is not, it's not a genetic thing that you're born being mathy.
Right.
You have to learn. You have to actually understand what a confidence interval is. You have to understand the difference between an estimate and or a model or a prediction and truth.
Right.
And it just yesterday, the Institute for Health Metrics and Evaluation updated their model on the estimated number of deaths uh, from COVID-19 in the U.S., and it was nearly double, and it kind of scared people.
Right.
But the model is as good as the inputs that go into the model. And when a model changes, it doesn't mean more people died. It means that the inputs of what they put in, social distancing, other
Hmm.
aspects, are different than the last model. And so I do think from both an education and a communication standpoint, we have some work to do on the modeling front.
We're seeing this happen in real time, right? I mean, we're a history organization. And so, we talk a lot about science past tense, and we talk a lot about sort of like, understanding the current moment, but like looking through the lens of history. But this is happening in real time. So there's also, I think, a lot of that's hard for people, I think, to wrap their heads around.
It's absolutely true. And I think the opportunity for all of us is to learn from what we're going through and to make ourselves more informed citizens. Democracy requires an educated population, and that's the other thing about the diagnostics and the modeling is it because we're 6 months away from um, a national election. These same things can be used not for science, but actually for politics. And so it requires people to kind of steel themselves and to be really cautious and thoughtful about what you believe and how you're informed.
From your perspective, what does public understanding of science sort of play in dealing with an epidemic like this?
The public understanding and even more importantly, public trust
Yeah.
are the essential elements of fighting a pandemic. The pandemics are frightening. Pandemics are frightening, and I actually I had just become the CEO of the Gates Foundation when Ebola happened, and I was shocked at how terrified everyone was. It was sort of like we had stepped in the middle of a horror movie,
Right.
and just calling something. I mean, Ebola was described as a hemorrhagic fever. Doesn't that sound terrible? It was just
Gosh,
really,
yeah, it
it was
does.
frightening, frightening,
Yeah,
frightening. So, and the novel coronavirus, COVID-19, is scary. It's scary, but the thing that all humans have in common is they want to protect themselves and their family. And so I think that the scientists have to go back to basic principles. We
mhm,
all want to protect ourselves and our family. We all need to have the information that's required to do that. And it needs to be delivered in ways that are appropriate for us. And so there's a move afoot, and I'm sure you know about it in your org, for scientists to do a better job of informing and communicating to the public in everything we do. In everything we do. And that starts with good science education in schools, but it doesn't end as you get older. And it's not boring and it's not dry. It's actually interesting and exciting. But
absolutely.
the and I mentioned modeling before because one of the critical aspects of informing the public is trust. And one of the challenges is pandemics. We use predictions, we use models, and we have to change what we say when the data changes. And so when you say on one day, and here's a good example with COVID-19 that I think was unfortunate. My read is that CDC and the federal government were very worried about the public using masks and buying up all the masks
Right.
when they were very much needed and in short supply for healthcare providers. And so discouraging people from using masks that, quote, you didn't need it or it wouldn't help,
Mm,
I think was the wrong message. Saying, look, don't buy up those masks because we need them for healthcare providers who need them more. That would have been valid. I think actually
right,
people would understand that. But now that we're pushing people to wear masks, it's become kind of political. And
right.
I think part of how it becomes political is a lack of trust. Well, you told us we didn't need it. And so what I push myself to do in the middle of tough things like this is to be comfortable saying, I don't know.
Mm,
Here's my best estimate, but I actually don't know the answer to that. I'll give an example. I don't know if there will be a safe and effective vaccine.
right.
I don't know, particularly if we can have a vaccine as fast as the companies and the academics are trying to have one. And God love them. I hope they're right.
Yeah.
But I don't know that because the fastest ever was a mumps vaccine in 4 years. And now we're trying for 12 to 18 months. So it's okay to say, I don't know. And I don't know because we've not tested enough people to know that the vaccines are safe and effective yet. And so if you go back to what the public wants to know, the public it can accept even hard things. I mean, there's a lot
Mhm.
of history um, of of citizens sacrificing, working hard, doing tough things when you're straight with them.
Right.
But that includes sharing uncertainty. And early science, pandemic science, is filled with uncertainty.
Right. That is yes. Yes. And I think, we're always trying to sort of pull back that curtain and help people see that that's always a part of the science. It's just not the part we see, right? We typically get it, oh, well, here's the thing that's all packaged and it makes sense and it's done. And we kind of assume that you start with a what if and then you descend pretty quickly to here's the answer, and so that's not the way it works. And so again, it is really interesting sort of seeing this play out in real time.
Exactly, exactly. And look, I think it's also really interesting to think about how we all, as the community of scientific leaders, get better at this.
Right.
I think it's good to be humble and understand where we've done a good job and where things haven't worked out so well. I'm in California right now, and I think in Northern California and specifically San Francisco, I feel like the staying at home and the communication around what's going on has been excellent. I mean, people are treated like grown-ups. They're given the
Hmm.
information that they need. It's hard,
Yes.
especially as it gets
Absolutely.
nicer. But you feel like you're doing your civic duty.
Right. Absolutely. And that is, that I think you're right. That sort of challenge across the board of how do we communicate this? We had a talk with the curator of the Motors exhibit Spit Spreads Death a couple weeks ago. And that was one of the things she was echoing too, the importance of sort of truth in reporting to people through this process. That like if you took anything from the 1918 pandemic, she said it, I hope it's
Yep,
that we need to be truthful and straightforward with people.
totally agree.
So that is definitely, I think, top of mind. I just want to say again, thank you so, so much. Is there anything at this point that we haven't chatted about that, you want to make sure we think about or we share with the people who listen to us?
Yeah, actually, the I remember at the very beginning of hearing from the Surgeon General and head of CDC, washing your hands,
Mm-hmm.
um, not touching your face, and keeping at least 6 feet distance from others around you remain extremely effective ways to keep yourself safe. And wearing a mask when it's hard to keep that distance, like grocery store or pharmacy. And in wearing the mask, you're protecting others.
Yep.
So the basics, really effective. And don't forget that.
I think, honestly, that's perfect advice for us to sign off with. I really appreciate it. Thank you so, so much.
Thank you.
Thanks for listening to this episode of Pandemic Perspectives. We'll be bringing you more interviews from all sides of this crisis, so stay tuned and watch your feeds. As always, you can find all of our episodes plus transcripts and show notes at distillations.org. And you can find tons of educational resources on our website at sciencehistory.org/learn. The Science History Institute remains committed to revealing the role of science in our world. Please support our efforts at sciencehistory.org/give now.